chiropractic care. Did you know that there's actually pediatric chiropractic care? And I think that's absolutely amazing. Now, pediatric chiropractic care is gaining attention as a natural and holistic approach to supporting children's health, and from improving posture and sleep to addressing issues like colic, ear infections, and developmental milestones. Chiropractic care is becoming an integral part of many families' wellness routines. Today, we have Dr. Ferzana Motala, who is a pediatric chiropractor, to help us understand the benefits of chiropractic care for children and how it can actually contribute to their overall well-being. A very warm welcome to Dr. Ferzana Motala to Urban Women. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam. Jazakallah to Razia for having me on the show today.
Barakallah, it's an absolute pleasure. Now, listeners, Dr. Motala actually graduated at the Derby University of Technology in 2009, subhanAllah, and has been in practice since 2010. So we're chatting with somebody who really knows what she's talking about. Now, I find this very exciting because often, we just go to the conventional route when it comes to helping our children, dealing with them. Okay, GPs, I'm not saying anything bad, but I'm just saying then we go for meds. But there's so many alternative ways that we can help our children in a holistic way, in a natural way. So share with us, doctor, what exactly is pediatric chiropractic care and how does it differ from chiropractic treatments for adults?
Okay, pediatric care, basically, it's a different branch. It's a specialized branch from your normal chiropractic care. And it's non-invasive with regards to treating peds as compared to adults. And contrary to what people think, you're not hearing the cavitations when you bring in your baby or your child to see us. We don't want to hear that clicks and that pops. The treatment for peds are completely different from treating an adult patient. And we see various factors coming into the treatment protocol when we're treating these little buggers.
So cute. So what are some of the most common reasons that parents actually seek chiropractic care for their children?
Okay, we see a lot of bedwetting kids. We call them enuresis. That's a medical term. But that obviously we're seeing in the bigger kids. We're seeing when they're not reaching their developmental milestones, as you previously mentioned just now, like sitting or crawling, when the child is taking a bit longer to do those milestones. We see a lot of colic, digestive problems with regards to constipation, reflux, projectile vomiting with kids. When they're not digesting their milk, where either if they breastfed or there's a problem with their formula feeds and things like that. Simple ones, postural correction is your main one with regards to our bigger children. And we don't only see peds, we don't only group pediatrics as babies. We group them as toddlers, then your tweens, that's basically before adolescence, and then your teenagers. So there's 3 different categories with regards to pediatric chiropractic.
All right. Thank you so much for that. And, I'm just thinking, wow, I wish I knew that when my child was suffering. We thought it was colic and so forth. And anyway, this is great for our new parents. But tell me something. I'm just wondering, because when we often think of chiropractic care, we think of manipulation of the bones, as you just said. Now, that's not what you want to hear. But is it safe for infants and also for young children? And what techniques are actually used to ensure their safety?
It's completely safe because, as I previously mentioned, it's non-invasive. And how I explain it to the parents who bring in their kids, it's basically the pressure that we use on the babies are like a pressure that you're going to be seeing if a tomato is ripe. So I use it on the parents first to show them this is all what I'm doing to your baby. And that's the manipulation. That's the force that you use on a baby. And in my practice, I use this activator technique. Activator is a little gun sort of a gadget, and it sends a thrust to loosen up the tension in the muscle spasms and the joints as such in the babies.
Wow, fascinating. So exciting. Now, we touched on that it can actually help to adjust with common childhood issues like earaches and colic and sleep disturbances. Do you just want to elaborate to help us to understand how chiropractic care can help in these aspects?
Sure. So why they bring their children to see a chiropractor? Firstly, they are fed up with regards to the other mainstream medication because their kids are frustrated, basically, right?
Correct.
And secondly, these children, especially the babies, they're not sleeping, they're having broken sleep, and
Mhm,
what that's interfering with are the parents, grumpy parents. They just
mhm,
want their children to feel better or just get a better night's sleep. Even if their children are sleeping for 1 hour longer that night, they are so grateful to you. And with regards to colic, digestion problems, very commonly sorted out by chiropractors who treat pediatrics. Ear infections, that's a bit of a tricky one. If it's not sorted out within 2 treatments of the baby coming to see me, I refer to an ENT or to a pediatrician.
Okay. Thank you so much for that. Share with us what can parents actually look out for when deciding to choose a qualified chiropractic or a pediatric chiropractic for their child.
Okay, so it's simple. We've got a Pediatric Chiropractic Association of South Africa. And with regards to the qualifications, all chiropractors are qualified to see pediatrics, right? But not specialized in a certain grouping with regards if you're saying pediatric chiropractor. So our council doesn't allow us to say you're a pediatric chiropractor, but we are registered under that thing that we are doing specialized courses with lecturers from all over the world, as well as South African lecturers. You can find our details on www.chiropeds.co.za. And there's a listing of all the chiropractors who are affiliated with this council and with the special association. And you are allowed to practice chiropractic pediatrics in South Africa. So all our
Oh,
listings are there in the different provinces and things like that. So that will put the parents more at ease that, hey, this chiropractor knows what they're doing with my baby.
absolutely. You're not going to hear any clicks and things like that, as you just mentioned. I think this is such a wonderful awareness for us to know the various options that are available in order to treat our children. We thank you so much, Doctor. We know what a busy person you are. We do thank you for your very valuable time. What is your take home message to our urban woman listeners as we wrap up this morning?
Firstly, I'd like to say we always look at the spine for diseases, like Hippocrates did say that. So that's
Hmm.
why we try and get to the source of the problem and we're not treating the symptoms. And
Mm-hmm.
Ramadan's just around the corner. I'd like to say to everybody, be conscious of your salah, your fasting and stuff like that. And in Ramadan, it's such a surprise, but it's my busiest month at practice because it's taxing on us mentally, physically, spiritually. So
Mm-hmm.
just have all your ducks in a row, prep yourself up from this week. This is your it's a marathon, it's not a sprint. So take it easy from day one, and inshallah everything will go accordingly.
Alhamdulillah. Well, here's a message coming through from Yumna Sheikh, best chiropractor. Well, she's definitely been with you. Jazakallah khair for your comment and clearly chatting with you. Yeah, we wish you and your family as well a blessed Ramadan as well. May it go smoothly for all of us and may we make the best out of it, inshallah. Dr. Farzana, until we chat again, Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam, Razia.
And that was Dr. Ferzana Motala, who is pediatric chiropractor, alhamdulillah, sharing with us certain things that I think is so important for us to remember that we can take cognizance in bringing it as part of our options when we're choosing how do we need to help our children with certain aspects if we want. And I know there's many parents that actually just want to go away from the conventional route of just giving medication, just giving antibiotics, but wanting to treat everything at the root cause, the source, and not just the symptom. Time for a break. We'll be back